Hello, everyone. It's Tiffany Bryant-Jackson, Education Manager here at Three Bone Theater, and today we're talking with our community partner for Eureka Day. I've got Dr. Maynard, or Dr. Washington, sorry, I was going to reverse your names, with me today from the County Public Health Department, and we're going to talk about some things that are near and dear to the show and where you can find additional resources right here in your backyard. Welcome, Dr. Washington. How are you?
Great. Wonderful. Thanks for having me.
Fantastic. We are dealing with a show that is walking through a day school and their decisions behind immunizations. And we wanted to make sure we partnered with someone had their who had their finger on the pulse in our local county. And we know, though the play takes place a few years ago, we have walked through a pandemic of our own here. And so I'd love for you to tell everyone what the county department does and why it's essential in times like this.
Sure. So we have a lot of hands and pots around sort of this issue. So I first want to say thank you guys for covering this. First and foremost, we are the public health department is responsible for ensuring that people in our community, particularly children, have access to immunizations. And so all of those in the state of North Carolina. There is a set of recommended immunizations for all children. So here at the Public Health Department, at all of our clinical locations, families can come in, receive those recommended vaccines at no cost to those families. And so that's one of the most essential things we do is create access. The second thing I'll mention is within our school district, our public school district, we're also responsible for school health. And so all the school nurses that work in CMS schools, our employees and team members here at Mecklenburg County Public Health. And they are critical partners because in North Carolina as well, to attend public schools, you also have to meet those vaccine requirements as well as some other health requirements. And so our school nurses help to make sure that kids who are in school, enrolled in CMS schools, are up to date on those vaccines. And they work with those families if the kid is not up to date to try to get them into our clinics or another clinic to be able to get their vaccines and stay on schedule. The last thing I'll mention that's really, really important, one of our statutory requirements as a health department for this local community is also communicable disease control. So when there is an outbreak of any infection that might be happening, whether it be in a school or a nursing home or in the community at large, we're first line defense to be able to help protect our residents. And so we have a team of communicable disease staff who work every day to make sure that if there is a case of an infectious disease, that we find those individuals as quickly as possible, we get them isolated and cared for, and also make sure that anyone that they may have exposed, that we get those folks notified, tested, and treated as appropriate. And so right now in our community, we are experiencing an uptick of infectious diseases that are associated with childhood vaccines, or infectious diseases that are preventable with childhood vaccines. And some of those things look like pertussis or whooping cough. We've also had cases of measles in the last several years. And so we continue to work to make sure our families are educated and also work to make sure that we contain any of those cases in terms of having spread in our schools.
So it sounds like you guys approach it from all angles. One, access and making sure everyone has the access. Two, if there is something going on, you guys are right there to make sure you are helping everyone in the situation and could have been. And three, helping people stay aware of what they need for their students going through the school system. I'm curious because in this play, the school is a private school. Does that matter in North Carolina with the public health, or are the rules for any school in North Carolina the same surrounding immunizations?
Yeah, so the rules apply to public schools, but I will tell you though, our work is universal. So we provide vaccines to students who go to public, private, charter, homeschoolers, to make sure that those kids are have access to those important resources. Vaccines, as it relates to these vaccine preventable conditions that most often impact children, are our best line of defense. And we also are responsible for continued communicable disease control. So if there's a case of, let's say, mumps at a private school, we are responsible for going on site to respond to that case, and we are legislatively required to do that. And so while we don't manage the vaccine compliance at private schools in terms of knowing, what level of vaccination rates they have among students, we are responsible for responding when they have incidences. And I will say, we have had a disproportionate number, even in our own community, of outbreaks that do involve some of our private schools that have lower vaccination rates.
Good information to know as we kind of dive into this show. I'm a little curious only because I read your bio, but I'd love for you to give everyone like your journey to get here. Um, because I looked at I was like, ooh, science. Uh,
Yes.
I was a theater major, so very hard for me. But I'd love for you to just talk about your entry into deciding to study this field and growing in this field.
Sure. So I'm an epidemiologist by training, which 10 years ago, people probably would have thought I was a skin doctor. But in fact, I'm a doctor that responds to epidemics. And so that's the work that we do. I did all of my training at the University of Pittsburgh, which I'm very proud of, held to Pitt. And as a part of that, I got into public health specifically as a result of me experiencing an outbreak actually in another country of malaria firsthand and realizing as a young person, as a 21-year-old, that there was a public health system that we often don't see. We don't hear about, of course, now because we had a global pandemic. Everybody knows about us. But before that, we were kind of the folks who were just restaurant inspectors or people didn't know all of what we did. And we weren't front and center. And so I was in East Africa, and I had the opportunity to experience, unfortunately, a really, really bad outbreak of malaria. And it made me ask, like, sort of, whose job is it to sort of respond to this and fix it? Because the folks at the hospital weren't able to fix it. They were basically trying to treat patients, and they were overwhelmed. They had set up an emergency hospital outside. And so it made me ask questions about the public health system. And then my professor, who I was with, said to me, hey, we have a Centers for Disease Control in the US, and we have state health departments and local health departments. And this is the work that they do every day to ensure that our residents are kept safe. So I went back to school and said, well, maybe I'll go study this. And that's how I got into epidemiology and realized very quickly that the action was really at the local level. And so my opportunity to be able to influence health in a community was really in local health departments. And it's really an honor to serve both as your all's health director here in Mecklenburg County, but to work alongside the more than 900 team members who work every single day tirelessly. Even when our work has become so politicized, they still work every day to make sure that we protect and promote good health in this community. And that's how I got here, and it's really a joy to do it.
Thank you for sharing that. Like I said, I was researching and I got to know your departments, but I was like, oh, let me figure out a little more about their leader. And it
Yeah.
was fascinating to me because it just shows that all of us kind of come into where we're going at different points in life and what sparks that interest, especially in community-led work. And so that's why I wanted to know a
Yeah.
little more and wanted to share that with our YouTube audience. I'm curious as you talk about the access points, just so our audience knows, is there an insurance barrier at all at any point, or is it truly everyone can come to the clinic when appointments are available?
Sure. Yeah. No, insurance is not a barrier at all, particularly for children. So in the US, we're very fortunate to have a federally supported program called Vaccines for Children. It was authorized several decades ago. And what it does essentially is ensures that all children are able to access those recommended vaccines without cost being a barrier. And so that is, we know there was a time in our country where a lot of people experienced measles, for example, and polio. But with the invent of vaccines, we've been able to eradicate those conditions in our community and spare families from the potential harm and grief that come along with those. And so vaccines for children, if you don't have insurance, covers the cost. But also, many of the children in our community, particularly those in working families that don't earn quite enough to be able to afford healthcare coverage, they are on Medicaid. And so Medicaid offers an opportunity as well to cover all those vaccines at no cost for families, also with no co-pays. So cost really isn't a barrier. And so again, you can come into one of the health department clinics, or again, if you have a student at one of our public schools, our school nurses are a great point of connection because they can also ensure that that student gets an appointment. But if not, we also have a mobile health program that actually goes on site to CMS schools and does the vaccines right on site. And so, again, if you have a student in CMS, feel free to reach out to your school nurse. She or he can help you, or give us a call here at the health department.
Awesome. And is there any way, whether it's spreading the word or being present when you guys have community events for people who, like myself, my children are adults and out the house, so I'm not thinking about those things. Is there a way for us to plug in and help out our health department?
Well, one of the things that's most helpful for us right now is folks talking to their neighbors. One of the things that we are continuing to experience following the COVID-19 pandemic is an increase of misinformation, disinformation, and also folks with skepticism about the safety of vaccines. And so it's really important for us to continue to have conversations in community and not to feed into sort of some of the polarization that's been happening. And so I think neighbors talking to neighbors is a great way for us to be able to, again, and the conversation is not convincing folks to get their kids vaccinated or not. The conversation is have a conversation with a professional. Talk to your pediatrician or talk to the health department. Call me, call our nurses. We're happy to have a conversation about sort of the risk, the benefits, the safety profiles based on what we know. I think that is the most helpful thing folks can do for us right now. Because again, we're sort of going against a bunch of counter narratives, particularly on social media. If you see stuff on social media that seems a little bit fishy, don't share it. Like just kind of leave it alone, because there are folks who again don't have the best intentions. And again, we do this work every day to keep our residents safe, right? And so that's our what inspires all of us to actually come work in government, work in this community, and serve. And so that's our motivation, and that's what how folks can help us. Really, is just to talk to each other and say, point people to reliable sources of information. And again, our local health department is here on the front lines. I know there's a lot of noise on the national stage, lots of noise from our federal partners. But again, local public health has been here. We have been here for over 100 years, and we're not going anywhere. And we're a trusted partner.
Thank you. And I just want to let everyone know if you're coming to the show, side note, show opens Friday, November 7th, runs through the 23rd. If you don't have your tickets, get them now. Trust me, there is a table in the lobby with all of the information laid out for our local health department, and especially the immunization clinic. There is lots of things with information you can take home with you, codes you can scan for more resources. So as you leave the theater, we want you to have access to grab that and kind of take that home. So that is set up for you at the theater. Thank you, Dr. Washington, for your time this morning and talking through. I know I'm fascinated to learn more about what you all do, and I love that this exists in our community and our children are in safe hands and assured safe hands through time. So I appreciate your time this morning.
Thank you.
You have a wonderful day. To
You
everyone
too.
else, get your tickets. Don't forget, the show runs. There are some days already close to selling out. This is my fair warning because sometimes people don't listen to you. See you next video.